Hello, and welcome to our channel today. We're diving into the wonderful world of exercise and its incredible benefits during pregnancy. Pregnancy and exercise has become a vital part of many women lives the physiologic changes associated with pregnancy, as well as the hemodynamic response to exercise. Some precautions should be observed. If women do not have medical complications and can maintain regular exercise duration of pregnancy, but women should avoid exercise that involves the risk of abdominal trauma, falls or excessive joint stress, as in contact sports and vigorous racket sports. Adequate hydration and proper ventilation are important to prevent possible effect of overheating. Physiology changes during pregnancy. Musculoskeletal changes is one of the most obvious changes in pregnancy is the alteration of the woman's body. Mechanical changes related to the weight of growing breast, uterus and fetus, as well as an increase in lumbar lordosis, results in a shift in the woman's center of gravity, which may cause problems with balance. Thermoregulatory adaptation. Fetal hyperthermia, leading to abnormal fetal development, is a concern if the mother's core temperature is elevated following exercise. In addressing this concern, the mother's resting body temperature is reduced and her ability to get rid of the skin is improved. Hemodynamic exercise acts in concert with pregnancy to increase heart rate, stroke volume and cardiac output. However, during exercise, blood is diverted from abdominal viscera, including the uterus, to supply exercising muscle. Measurements of the effects of exercise on fetal heart rate demonstrate either no significant change or short-term increase of 5 to 15 beats per minute. Oxygen demands with mild exercise. Pregnant women have a greater increase in respiratory frequency and oxygen consumption to meet their greater oxygen demands as exercise increases to moderate and maximal levels. However, pregnant women demonstrate decreased respiratory frequency, lower tidal volume, and maximal oxygen consumption. Energy demand. Both exercise and pregnancy are associated with a high demand for energy. In the first 2 trimesters per day is recommended. An increase of 300 calories per day is required in the 3rd trimester. Caloric demands with exercise are even higher. Although no studies have focused on exact requirements, the competing energy demand of the exercising mother and the growing fetus raise the theoretic concern that excessive exercise might adversely affect fetal development. Hormonal adaptation like estrogen stimulate the growth of the uterus and breasts, and high level of estrogen can result in excess water retention, nausea especially in the 1st trimester, and joint looseness. Progesterone thickens and develop the wall of the uterus, controlling and relaxing to stop contacting excessively. Relaxin softens ligament, cartilage and the cervix, allowing these tissues to spread during delivery. This is a major area you should be careful whilst doing stretching exercises. Insulin resistance increase during pregnancy. This make the pregnant women pattern of energy utilization similar to that of a mild diabetic. In mid and late pregnancy, insulin resistance serves to utilize more fat for maternal energy and rest during exercise. Impact of pregnancy exercises performance. In the 3rd trimester, women go through major changes and have to be careful with exercise. Of the 6 months of pregnancy, intensity exercise are decreased. Exercise such as cycling or swimming are very helpful. Research has shown that moderate exercise in late pregnancy does not influence on premature birth, shooting membranes or damage to fetuses. Recommended exercise. Walking is one of the best cardiovascular exercise. For pregnant women, walking keeps you fit without jarring your knees and ankles. It is safe throughout the 9 months of pregnancy and can be built into your day-to-day schedule. Jogging or running. Going for jog is the quickest and most efficient way to work your heart and your body. You can tailor it to your schedule, running 15 minutes one day when that's all you can fit in, and 30 the next when you have the time. Swimming. Healthcare providers and fitness experts hail swimming as the best and safest exercise for pregnant women. Swimming is ideal because it exercises both large muscle groups, arms and legs, provide good cardiovascular benefits, and allow pregnant women to feel weightless despite the extra weight of pregnancy. Aquanatal classes. Many women find aquanatal classes enjoyable during pregnancy. Exercise while standing in water is gentle on joints and can help lessen swelling in legs. which is a common symptom in late pregnancy. Yoga and stretching can help maintain muscle tone and keep you flexible with little if any impact on your joints. However, you may have to augment yoga regime by walking a few times a week to give your heart a workout. Be careful not to overdo the stretching. You will be more supple as a result of the effects of relaxin, which causes your ligament to be more pliable. Don't hold to the stretches for too long or try to develop your flexibility too much. Pilates is a form of exercise which combines flexibility and strength training with body awareness, breathing and relaxation. The exercises are based on certain movement pattern. Perform with your tummy and pelvic floor muscles known in Pilates as the core or base. These muscles are also known as deep, stabilizing muscles because Pilates target the tummy and pelvic floor muscles, and these muscles can weaken during pregnancy. Pilates exercises can be useful. Low-impact aerobics. One good thing about an aerobic class is that it's a consistent time slot when you know you'll get some exercise. Specifically designed for pregnant women, you'll get to enjoy the camaraderie of others just like you and can feel reassured that each movement has been deemed safe for you and the baby. Contraindications to exercise. Women with medical complications should be encouraged to avoid vigorous physical activity. Contraindications. Pregnancy include induced hypertension, preterm rupture of membranes, preterm labor during the prior or current pregnancy, incompetent cervix or cerclage placement, persistent second or third trimester bleeding placenta, previa intrauterine growth retardation, and also there's relative contraindications. That includes chronic hypertension, thyroid function abnormality, cardiac disease, vascular disease. Thanks you for watching, and don't forget to like and subscribe for more informative content.